The future is female is one of the more famous taglines coming from the mouths of feminists. Now what if we applied that to our profession? The future of athletic training is female. Even as we look at our own classes here at Kent, we see that women dominate the classroom. Currently, 65% of the existing NATA student population are women, and I'm sure we'll see that number rise within the coming years. When looking at the current NATA certified athletic trainers, 55% of them are women, another number that is sure to increase. These numbers prove that within the profession of athletic training, we must understand and recognize the importance of women in the workplace. When looking at the profession, it is easy to see where we lack in gender diversity and inclusion. The NATA stated multiple improvement areas in order to promote gender diversity and gender inclusiveness. The first area that needs to be improved for gender inclusiveness is salary. There is a significant salary gap when it comes to comparing females to males. As of February 2019, the gender gap between males and females was $8,768, which has significantly improved from the $12,249 gap of 2011. This can be due to the fact that higher paying settings such as professional sports or Division I positions have a much lower percentage of women ATs. Which brings up another important point, that in order to be more inclusive, we should open all settings for women, as they make up more than one-half of the athletic training profession. As of 2017, only a quarter of all full-time athletic training positions in the Division I setting were filled by women. Many individuals who are involved in the hiring process still fall in the old ways and old stereotypes. Many believe that if the patients are predominantly male, then the position must be filled by a male. But this is the old way of thinking. Studies show that male and female athletes do not have a preference of male versus female athletic trainers because they understand that their education and skill set is comparatively the same. Although, in regard to the hiring process, we need to focus more so on skill set. Our gender does not define our abilities or skills as a clinician. People might laugh at the idea of a female athletic trainer performing knee special tests on an O lineman. But if I can perform a flawless Lockman's test simply by changing my hand placement, why should I be looked at as a less competent AT because I cannot perform the skill set by how it was taught in the book? I should be defined by my achievements and what I bring to the table and how I can better the athletic programs and the health of our athletes, not by my gender or my stature comparative to athletes. This can also be a segue into the athletic facilities and how they hinder the hiring of a female athletic trainer. Why should a woman be turned away from a high-paying job simply because the location cannot provide a facility for a woman to work in? Because the architects decided the athletic training facility can only be accessed through the men's locker room. This is yet another reason why women cannot work in specific settings. While there has been a change in society's view on breadwinning males and stay-at-home moms, this too could be a reason as to why women are not considered for certain positions. I would like to see the statistics on a mother's work productivity or their ability to perform their job while also being a mother. Women should not be penalized for having a child, starting a family, or wanting to live her life. This is another topic of discussion regarding work-life balance, but if men can do it, why can't women? Lastly, we need to place and respect women in positions of leadership. Currently, in the NATA, 4 of the 10 seats of the board of directors are held by women. And of the 26 NATA committees, 9 women hold a chair or chair-elect position. Many will still disrespect women in a leadership position because some individuals feel as though they cannot act as a leader due to being a pushover or easily criticized for being bossy, not to mention the individuals who still blame a woman's anger on PMS. Football players at Division I University stated that due to a woman's nurturing and caring persona, they would be incapable of performing in the role of head AT because they lack assertiveness. Many also attribute this to the fact that many women do not work with football because their personalities do not align with the masculinity of the sport of football. So how can we place women in positions of leadership if they are not respected by the individuals they are leading? I believe that women have a lot to offer in this profession and have many attributes that make them a quality candidate for a job in the NFL, Division I setting, and even in the leadership role of a head athletic trainer. There is no doubt in my mind that women athletic trainers have the leadership skills, the strong work ethic, communication skills, the ability to multitask, and many other unique attributes. They also take advantage of opportunities that many would look past and use them in order to get ahead in the profession, as well as using them to perform professional relationships and network with other individuals in the profession of athletic training. As a female in the athletic training profession, I can say that I have used the opportunities and networking to get where I am today, and hope to see a greater change in the role that women play in this profession. I believe that we are strong leaders and more than capable to perform the skills in order to advance in this profession and promote the change for gender equality in athletic training.